Yeah, the recovery after knee replacement is one of the most common questions I get asked, and it does vary from person to person. There's, broadly speaking, 3 phases. So in the early stages, when you're in hospital, you're learning to walk again with crutches over short distances, so 20 to 30 yards, learning to get in and out of bed to the bathroom, for example. If you've got stairs at home, you'll need to be able to do those before you go home, and that will be supervised by the physiotherapists with help from the nurses on the ward. Once you get home, things will become easier, and day by day things will improve. So by the time you get to 6 weeks, you should be coming off your crutches and you'll be able to walk outside of your house. Most people are driving at about 6 weeks after a knee replacement. By the time you get to about 3 months, you'll be walking 300 or 400 yards. Okay, so you'll be able to walk around the block, pop around the shops. It's important to realise that at that stage your knee is still likely to be a bit sore and a bit swollen. So you won't be there yet. You're probably about 80% recovered at 3 months. To get to 100%, it takes about a year. So you do have to be patient, but it does come with time.